Is sudden anger in a senior just moodiness, or a sign of brain damage? On Wellness 60 to 100, your trusted guide to healthy aging, we explore how unexpected anger can indicate neurological issues rather than simple mood swings, and why early recognition is vital for care and recovery. James, a 74-year-old retired engineer from Chicago, was known for his calm and gentle nature. However, over the past several months, his family noticed a startling change. James began having frequent angry outbursts over minor issues, shouting at family members, slamming doors, and displaying uncharacteristic impatience. At first, they assumed it was just grumpiness associated with aging. But when his behavior escalated, they sought medical advice. Tests revealed James had suffered several small, silent strokes affecting brain regions that control emotion and impulse. This brain damage was the real cause of his sudden anger, not just moodiness. James's story is a common but often misunderstood phenomenon. Many seniors and families mistake neurological symptoms for psychiatric issues or personality changes, delaying appropriate diagnosis and treatment. Recognizing that unusual anger in older adults can stem from brain injury is crucial. It opens the door for targeted therapies, support, and improved quality of life. James's journey shows that behind unexpected anger may lie treatable brain conditions, and early action can make all the difference. I'm Dr. Emily Carter. Sudden anger in seniors is often misunderstood as moodiness, but it can signal brain damage affecting areas that regulate emotion and impulse control. Early identification is key to distinguishing neurological causes from psychiatric disorders, allowing timely intervention and better management of symptoms. On Wellness 60 to 100, we explore why sudden and unusual anger in seniors may not be simple moodiness but a sign of brain damage. Damage to brain regions responsible for emotion regulation and impulse control, such as the frontal lobes, can cause unexpected outbursts. Early identification of these neurological changes is crucial for effective treatment and support. This episode will help families recognize warning signs, understand the difference between mood disorders and brain injury, and learn strategies to manage symptoms, ultimately protecting mental health and improving quality of life for aging loved ones. Understanding why unusual anger occurs in seniors requires exploring the brain regions responsible for regulating emotion and impulse control. The brain's frontal lobes, particularly the prefrontal cortex, play a pivotal role in managing our responses to emotional stimuli and inhibiting inappropriate behaviors. The prefrontal cortex acts as the brain's executive center, enabling us to plan, reason, and regulate our emotions. It helps control impulsive reactions by assessing situations and deciding the most appropriate responses. When this area is functioning well, it prevents sudden outbursts of anger and helps maintain social harmony. Another important region is the amygdala, which processes emotions such as fear and anger. The amygdala signals the body's fight or flight response when it perceives threats. Under normal conditions, the prefrontal cortex modulates amygdala activity, keeping emotional reactions balanced. However, in many seniors, the frontal lobes can suffer damage due to small strokes, neurodegenerative diseases, or trauma. When the prefrontal cortex is impaired, its ability to regulate the amygdala diminishes, leading to increased irritability, aggression, and impulsivity. Studies using brain imaging have shown that lesions or atrophy in these regions correlate strongly with behavioral changes, including sudden anger. Moreover, damage to the orbitofrontal cortex, a part of the prefrontal cortex linked to social behavior and decision-making, can cause disinhibition, making seniors prone to inappropriate anger. Understanding these brain mechanisms highlights why unusual anger is often not a simple mood issue but a neurological symptom. Recognizing this is crucial for early diagnosis and effective management. Sudden emotional outbursts, including unusual anger in seniors, often stem from damage to brain areas responsible for regulating emotions and controlling impulses. This damage can be caused by small strokes, traumatic brain injury, neurodegenerative diseases like Alzheimer's or frontotemporal dementia, or other neurological conditions. When brain cells in the prefrontal cortex and connected areas are injured, the brain's ability to modulate emotional responses diminishes. The prefrontal cortex acts as a brake on the more primitive emotional centers like the amygdala, which drives fight or flight reactions. Damage weakens this brake, leading to disinhibition, where emotions like anger or frustration become exaggerated and difficult to control. In particular, small vessel disease in the brain can cause multiple tiny strokes, often going unnoticed initially but cumulatively disrupting communication between brain regions. This disrupts the circuits controlling mood and behavior, causing sudden irritability or aggressive outbursts. Similarly, frontotemporal dementia is characterized by early changes in personality and behavior, including increased anger and impulsivity, due to degeneration of the frontal and temporal lobes. Emotional outbursts may also be a response to frustration arising from cognitive decline, such as difficulty understanding conversations or performing everyday tasks. The individual may feel overwhelmed and express their distress through anger. These outbursts are often sudden, intense, and disproportionate to the situation, confusing family members who may misinterpret them as intentional or mood-based. Recognizing that these behaviors result from brain damage is essential. It shifts the approach from blaming or punishing the individual to providing understanding, appropriate medical care, and behavioral interventions. Unusual anger in seniors can arise from different causes, including psychiatric mood disorders such as depression or bipolar disorder, as well as neurological damage. Differentiating between these origins is crucial for proper diagnosis and treatment. Neurological anger typically results from physical changes or injury in brain regions responsible for emotion regulation. This type of anger is often sudden, unpredictable, and disproportionate to the situation. It may occur alongside other cognitive symptoms such as memory loss, confusion, or difficulty with language and executive functions. For example, damage to the frontal lobes can impair impulse control, leading to rapid mood shifts and aggressive outbursts without apparent triggers. In contrast, psychiatric mood disorders usually develop gradually and have recognizable patterns of mood changes over time. Anger or irritability in these disorders is often linked to identifiable stressors or psychological conditions. Patients may also experience periods of low mood, anxiety, or mania. Clinicians use detailed history, neurological exams, and brain imaging to distinguish between these causes. For neurological anger, there may be evidence of brain atrophy, stroke lesions, or degenerative disease. Moreover, neurological anger is often less responsive to typical psychiatric medications alone and may require interventions targeting the underlying brain condition. Family members and caregivers should be aware that angry outbursts might not be intentional or purely emotional but signs of brain dysfunction. Understanding the difference helps reduce stigma and promotes empathy. Proper diagnosis leads to tailored treatment plans combining medication, behavioral therapy, and support, improving outcomes and quality of life. Families often struggle to recognize when a senior's sudden anger indicates underlying brain damage rather than simple moodiness. Being aware of specific warning signs can prompt timely medical evaluation and intervention, improving outcomes. 1. Sudden change in behavior. A previously calm and patient senior who begins exhibiting frequent angry outbursts or irritability without clear triggers should raise concerns. This change is often abrupt rather than gradual. 2. Disproportionate responses. Outbursts that are extreme or inappropriate for the situation, such as intense anger over minor inconveniences, may suggest neurological issues affecting impulse control. 3. Cognitive decline. Signs like memory lapses, difficulty concentrating, confusion, or language problems alongside anger indicate that brain regions related to cognition and emotion may be compromised. 4. Social withdrawal. Increased isolation or withdrawal combined with mood swings can reflect frustration or inability to regulate emotions due to brain damage. 5. Physical symptoms. Changes in motor skills, balance, or coordination, or a history of stroke or head injury, strengthen the case for neurological causes. 6. Lack of insight. Seniors with neurological anger often don't recognize their behavior as problematic, unlike mood disorders where patients may feel guilt or remorse. 7. Resistance to treatment. If anger is resistant to typical psychiatric medications or therapies, it may point to neurological origins. Families noticing these signs should consult healthcare professionals promptly. Early diagnosis through neuroimaging and cognitive testing can identify brain damage and guide appropriate treatment. Timely recognition not only improves care but also helps families understand the cause, reducing frustration and enhancing support strategies. Addressing unusual anger in seniors requires a comprehensive approach combining medical treatment, behavioral strategies, and caregiver support. Effective management can improve quality of life for both seniors and their families. Medical treatments. Once brain damage or neurological disorders are diagnosed, targeted treatments can help manage symptoms. For example, medications such as mood stabilizers, antidepressants, or antipsychotics may be prescribed cautiously to reduce irritability and aggression. In cases of stroke or vascular damage, managing underlying conditions like hypertension and diabetes is crucial. Cognitive rehabilitation therapies aim to improve brain function and emotional regulation. Behavioral interventions. Therapists often use techniques like cognitive behavioral therapy, CBT, adapted for seniors to teach coping skills and emotional control. Anger management programs can help patients recognize triggers and develop alternative responses. Structured routines and calming activities, such as music therapy or gentle exercise, reduce agitation. Caregiver support. Family members play a vital role in managing neurological anger. Education about the neurological basis of behavior fosters empathy in patients. Caregivers benefit from support groups and training in de-escalation techniques to handle outbursts safely. Environmental modifications. Creating a calm, predictable environment helps minimize stress and frustration. Reducing noise, clutter, and overstimulation can prevent triggers. Regular monitoring. Ongoing medical follow-up ensures that treatments remain effective and adjust as the condition evolves. While neurological anger can be challenging, these combined strategies offer hope. Early recognition and comprehensive care improve emotional stability, enhance relationships, and maintain dignity for seniors facing brain-related behavioral changes. If unusual anger in seniors goes unrecognized and untreated, it can severely impact relationships, leading to social isolation and emotional distress for both the individual and their family. Persistent anger outbursts increase caregiver stress and may result in neglect or abuse. The emotional turmoil can worsen cognitive decline, depression, and overall health. Additionally, unresolved brain damage can accelerate neurological deterioration, reducing independence and quality of life. Early identification and intervention are essential to prevent these consequences and support healthier aging with better emotional control and social connections. When a senior shows sudden, unusual anger, it's important not to dismiss it as simple moodiness. This behavior can signal underlying brain damage affecting impulse and emotion regulation. I recommend families seek medical evaluation promptly to identify neurological causes. Treatment may include medications to stabilize mood, cognitive therapy to improve emotional control, and caregiver education on managing outbursts safely. Creating a calm environment and maintaining consistent routines also helps reduce triggers. Patience and empathy are essential. Remember, your loved one's anger is a symptom, not a choice. Early intervention can improve quality of life, protect relationships, and support healthy brain aging. Don't hesitate to reach out to healthcare professionals for guidance and support. Dr. Emily Carter. If you've noticed sudden anger in a loved senior, don't ignore it. Like, comment, and share to raise awareness. Subscribe to Wellness 60 to 100 for expert advice on healthy aging and hit the bell to stay informed about early brain health signs and care strategies.